Hello, everyone, and welcome. We're just going to wait for a couple of minutes as people join us online. In the meantime, I'll go through housekeeping in a bit, but in the meantime, just if you want to go over to select your language interpretation down at the bottom of the screen, please do that. We've got live translation for this session. So welcome, everyone. I'm just going to wait a few more moments before we start. Okay, so in the interest of time, let's start today. Today's session is building capacity and collaboration in health research. Thank you for joining us from wherever you are. Good morning, good afternoon, good evening. We'll go through a bit of housekeeping first of all and introduce the speakers. We've got a very packed schedule for today. So in terms of housekeeping, this webinar is being recorded and will be shared on the Global Health Network on the Latin America and the Caribbean Knowledge Hub. This webinar has simultaneous translation, so you can navigate to the toolbar at the bottom of the page, click on language interpretation and select your desired language input. To automatically translate the speech to subtitles in your chosen language as well, you can navigate to the closed captions function and select your language there. Due to the number of participants in today's webinar, your video and microphone have been disabled. So please use the chat function, first of all, to introduce yourselves, to say where you're from. It'd be fantastic to hear from you. But also for any technical issues, the team from the Global Health Network can support you. If you have any questions for the presenters, please use the Q&A function to post those questions and comments. You can do this anonymously if you wish, or include your name. And you can find that at the bottom of the screen as well. Okay, so here's a little example of who's registered for today's webinar, and you can see it's got a great global reach. So, of course, we have a great representation from the Latin America, Caribbean area, the Americas, but also we can see people who've registered from Ethiopia, Uganda, Nepal, Pakistan. So it's fantastic to see such a diverse and global reach of people. In terms of the panel and agenda, I'll introduce each speaker just before their presentation, but just very briefly, this is a session looking particularly at Pathfinder projects, and we're going to be having 6 different presentations of various projects across the Latin America, Caribbean area. So we'll be hearing first of all around the Pathfinder TB-TSD tool from Danny in Argentina, the Pathfinder project in the Dominican Republic from Luis, Pathfinder for dengue and infogrippe from Brazil, from Sarah. Pathfinder work from strengthening community engagement from Juan Pablo, and the study in Zika study in Honduras from Katia, and lastly, preliminary insights from the Peru Pathfinder project from Tanya de la Cruz. And like I said, I'll give a more of a bio and introduction to each speaker just before the talk. Very briefly, the Global Health Network, we're a vast global knowledge community of over 1 million members, disease agnostic, translation of knowledge, resources and tools. And it really is focused on this equity of making sure that there's a real equity in where research happens, who leads and who benefits from that evidence. And this Pathfinder process is very much part of supporting the ethos of the Global Health Network in that respect. We're a World Health Organization collaborating center for research information sharing, e-learning and capacity development as well. Next slide, thank you. So in terms of what we do, we're very much focused on flipping this research pyramid. So we've got, traditionally there's kind of 90% of health research benefits less than 10% of the world's population. And a lot of this work is done from these often from the global north countries and focus on these kind of established old research institutions. And what we're really looking to do is shifting that focus from that sort of top level research units to that grassroots community level professionals, people who have the real kind of know-how, what's needed and happens on the ground, and support the ability to conduct research in that area. So building those capabilities and leadership among local healthcare providers to conduct that research. And the Pathfinder project, the structure, the framework is very much about supporting that. So it's moving away from that reliance on these small number of specialized units to prioritizing research on diseases and health challenges which are actually required and needed and are most relevant to local communities, and enhancing that ability of local health systems to respond to emergencies and pandemics. So really supporting that base fundamental level and the ability to conduct research on the ground. Next slide, thank you. It's a very short diagram here, but of course we know what the barriers are. But just as an example, we've conducted several surveys with many members, and of course, not surprisingly, the research skills training and that need for support for research really fundamentally kind of comes on top as one of the needs across the world. And so we know from the work we've done that what we're doing. What we're trying to support with the Global Health Network and with Pathfinder projects is really supporting those key needs globally. So in terms of what we have, we really look at all the resources and tools we have on the Global Health Network and supporting this research cycle, this fundamental, whatever you're doing, whatever kind of work you're doing, it doesn't really vary between the diseases. So, you've got to set the question, you've got to think about how to engage the community, how are you going to measure, how are you going to operationalize your research, and all the way up to the need for uptake into policy or practice. So that learning by doing generates evidence to address local priority health burdens, create abilities to spot and stop a new outbreak or develop innovative approaches to tackle existing diseases. And what we have across the Global Health Network are tools, resources, training, which can help all elements of this research cycle. So next slide, please. How does the Pathfinder fit in with this? Well, it's there to guide teams through each step of their research. So from setting the question all the way up to policy uptake, what methods might be needed on the way. It's a standardized framework, but it can be adapted to specific settings. And we'll be getting some examples of that from the talks coming up. It tracks the key steps, the challenges, the solutions, and the tools to be used, and it can also be applied to studies which have been completed retroactively as well, so documenting those key components as you go through. It's capturing the best practices, and this removes barriers to research. It's learning from others and also then sharing and communicating those results to a global audience. And again, this webinar today is an example precisely of that. In terms of these Pathfinder projects, you can find these on the LAC Hub. So if you go to Fiocruz Pathfinder on the LAC Hub there, you'll find examples of what we'll be looking at today. And so if we go to, I'll just introduce Danny, our first speaker. So Daniela Reyes Morelli works in the Institute of Clinical Effectiveness and Policy Health in Argentina. She's a nurse and health researcher committed to advancing research, education, and professional development in healthcare. She's also a regional coordinator for Latin America and the Caribbean and the Global Research Nurses Project in particular. She has bachelor's degrees in nursing and health technology and an MSc in clinical effectiveness, and she's a specialist in education. Danny, over to you. Yes, we can hear you.
Okay, so this is a study that had to be applied. It was practically ready, and the pandemic came. So Argentina had such a great lockdown. We were confined for 8 months. So this study, it couldn't start because of the limitations imposed by the pandemic and legal restrictions we had in Argentina. So we had to stop and reaccommodate the study, and because of this unimaginable moment we were living. So when we saw a call for Pathfinder in Argentina, we requested this host study, and we believed it was a good study to be applied with this framework so we could understand how to overcome the difficulties imposed by this moment in a sanitary system. So Pathfinder was exactly to map barriers and how they were overcome in the pandemic context. We applied this Pathfinder framework, as you can see and listen. Those who are learning about it for the first time, you can be at ease because all information is on the platform. We're going to share links for you to read my paper explaining what this Pathfinder framework is, because we don't have time now to explain all that in this presentation. But basically, it's a mapping of processes, and we apply this framework to map the different stages of the whole study. How do we apply a clinical essay for this? Um, so it was requested to keep the same methodological and ethical rigor and scientific methodology. And we started this whole study. We were approved for the project and in this call from the institute. And since then, we had all the stages required. So just so you have an idea, those in research, part of the approval and ethics, the research teams of both studies must interact very closely. So we learned along the way. And after we established processes to understand the Pathfinder framework, it was the first Pathfinder we would have, which was one of the first in Latin America. So it was also a challenge to understand how to apply this framework uh, because it was a clinical trial with all requirements of a clinical trial. So along the mapping, the Pathfinder team was feedbacking into the system the results we had to understand all that was happening at this moment, specifically to the entry in this location. So recruiting, training of teams, the streamlining flows, because nothing had been planned in advance. The Pathfinder team feedbacks into this host so we could reach our final results. And us as hosts, we hoped we would have something we expected to find some barriers, but we never imagined we would get so much information and so detailed in the mapping of the process. Our specific results in terms of ethical or operational barriers. But the most interesting part was to identify strategies that the host was applying in real time to overcome problems, and all stakeholders involved, and how they were so important in different phases of the host study, especially and fundamental for this kind of study was that with all changes and all strategies, mitigations that was incorporated, we kept the integrity of the study, and the safety of our patients. We can never lose sight of that as researchers. So it's very interesting because we might be talking about virtual methodologies, one of the strategies we used in the whole study and identified in the Pathfinder study. But when the pandemic came, everything was locked in this healthcare system. Access was completely blocked to assistance and investigation research at the first moment, at least in Argentina. So we had to quickly incorporate technologies and adapt to processes and procedures without losing sight of methodological and ethical rigor. That was fundamental, and it was very strongly present in our mapping. And a great thing Pathfinder brought to us as a result is the quality of human talent, humans participating in this study, and institutional capacity also to adapt and incorporate. Resources to overcome difficulties. And nowadays, these resources are common and they are used every day by the Institute. But then it was all so new. So, as a lesson, it's very important for you to are listening to understand that a Pathfinder study host, you should be a host because we learned so many important lessons, and you'll find and incorporate into your team the Pathfinder group. Um, that's very committed because you will need to dedicate time. Both the host and the Pathfinder team will need to put time in, and the interaction between the teams is fundamental. We'll have to work together, the Pathfinder team and us, to allow for progress of this process. Obviously, the funding of Pathfinder in case of these projects, hosting also supported economically this project so our results could be disseminated in international conferences. But mainly, the great lesson was that we have a complementary perspective now as hosts. The study team was focused on result, and but everything that was done was adapting to everything that was involved in that pandemic context. There was no time to develop things, so we had Pathfinder as a complementary resource, helping us understand and find our capacities to adapt. And over time we understood what worked at that moment, and in studies developed by the institution, always keeping ethical rigor was a priority of the whole study. And that's why I say it's important to have a team that wants to participate and wants to be part of your whole study and is prepared to go through the corresponding ethical steps. And especially from the first Pathfinder we had in Argentina, it was such an excellent experience and information. Now we are having a second Pathfinder, a study that's almost experimental on the existence of. Anyway, I'll invite you now to be encouraged to enroll and try Pathfinder. I'm going to share my paper where you can read in detail about the framework and apply in your institution. So thank you very much, and I hope the experience of our partners and other institutions will be as interesting as our experience in Argentina. Thank you.
That's wonderful. Thank you, Danny, for giving that background with that first Pathfinder project. That's excellent. Um, we'll move on now to the mapping of stakeholder engagement in the development and implementation of a TB digital tool. This is going to be for Luis Felipe Arias. So Luis is a researcher based at Ethicos in the Dominican Republic and is a regional coordinator for the Global Health Network, GLAC, and the MESH community area. He's a clinical psychologist by background, has extensive training and experience in community engagement and implementation research. He's got experience in research and engagement in mental health and violence and prevention in school settings, in the use of digital tools in the treatment of TB, and in research ethics reviews. Louis, over to you.
Obrigado, Adam. Vamos falar. We are going to talk about a mobile app to improve adherence in TB patients. In all these studies, we could be receiving treatment using this app where they could record themselves taking the medication. And on the other hand, the team watched that and approved it or not. And maybe they would have to go to the healthcare unit every day over 6 months. And in this way, we tried to improve adherence. It started in 2019. We developed this app, and due to COVID, we couldn't implement in scale as a first thought. Then the study had a second phase where it got other applications in 2024, trying to apply to, and improve scale to prove if adherence was actually improved or not. And even if there was a way to implement the study, we couldn't scale implementation. It was interrupted because of the pandemic. So I'd like to take some time to talk about the experience on the process of the study. And this is where Pathfinder gets. The context of the whole study was local approval and funding of the study. A pilot was carried out in healthcare centers in the urban settings. The funders' interest was around the tool itself and nothing else. The project had two major phases. The first was interrupted by COVID, and then the second didn't count on the same level of implementation we expected. And when Pathfinder came, the study had already been completed. So it was a retrospective Pathfinder. Pathfinder was systematized experiences, talk about the challenges faced about the host project, and try to identify lessons learned for the implementing institution. It came on the one hand to seek experiences in the system, but also the perspective of the host team is that things happened during the study that needed to be documented and shared. Future experiences will be for the region as well. The methodology of the Pathfinder was through semi-structured interview with the host team. There was another team designing and creating the questions. We analyzed documents, protocols, minutes of meetings, interviews and presentations, and also workshops that were based on the tools. We use the Pathfinder tracker for thematic analysis of the information that we collected. What are the challenges we met along the way? First, during Pathfinder, we observed it was difficult to collect relevant information for the project because it was a 5-year project. So information in Pathfinder showed in Tracker that it was important to collect an external perspective. But at the time, it was not possible to collect that. It was not written, and uh, we also had many changes in staff, so things were hard to retrieve. Also, there was a lack of interest on the part of the implementing institution. Um, and also there was difficulty in social engagement, uh, not in a systematized way with prior stakeholder mapping. So these were some of the results were gaps in the research, and there was some failures because of the lack of institution to prove the tools. From that, our lessons learned were that we need to have institutional standards to ensure good practices in health research, focused on documents and risk analysis as well on the part of the host institution. We created recommendations of good practices during the process of research, and also as a practice in each project and risk analysis to prevent situations such as the ones that happened in this project. Everything was doing so well, but when we got to the application part, it was not implemented. From the mapping of the Pathfinder project, we identified that the digital tool was developed but not implemented because there was no social commitment of the institution, the implementing institution. This was also seen as a process of research that ran as expectedly. It was flowing during all phases, but when we got to implementation, the implementing institution requested the tool to be delivered to them, but they didn't have it implemented in scale to prove that adherence would be improved in terms of TB. So we noticed we needed a plan for commitment since the beginning of the project to involve stakeholders, because if you have a plan from the beginning and it's systematized and it includes the mapping of stakeholders, then no relevant stakeholder will be left out of the planning of the activities. And you can involve all stakeholders considering the interests in power. In the case of implementing institutions, an actor with lots of influence in the project. Uh, but the interest fluctuated. In the beginning, it was interested, but then at the time of implementation, he was not so interested anymore, these agencies. So the planning helped to choose centers, but at the time of implementing, interest waned. So the project stopped at that moment and it didn't end as expected. We couldn't complete it as expected. So, in terms of the Pathfinder, this is an experience that our project had, and it was proved how the mapping must be made. There were flaws in the process. So, being if changes are made in a future project, this Pathfinder can strengthen our capacity. So future projects will follow good practices in health research and social commitment that are formalized since the beginning of the project, with a mindset that will follow up on the interest of stakeholders and other parties, seeking to strengthen the research projects so they can reach their completion correctly. So, thank you.
That's great. Many thanks for your phone. Yes, it's great to be able to share those the sort of the challenges and the lessons learned. That's a really key part of what this Pathfinder process is about. To look back 5 years later down the line and say what could we have done differently. And of course, there's always going to be things, but the idea behind this is that by being able to share this information, we just help reduce some of those restrictions. I'm sure we'll come back later on to talk about that importance of stakeholder engagement once we've heard all the presentations. We'll move on now to Sara Oliveira, who's going to be speaking about the Pathfinders in Infodengue and Infogroup, the lessons from alert systems to monitor arbovirus and SARS in Brazil. So Sara is an epidemiologist from ENSP Fiocruz. She's worked with epidemiological analysis and data creation of arboviruses in the Infodengue project for over 10 years. So Sara, over to you.
Hello, everyone. Good afternoon. Today I'm going to talk a little bit about our lessons learned from Pathfinder uh, in the Infodengue and Infogrippy projects. We're going to talk about the main challenges and solutions we found during our work in these projects, because both projects, although they are different, they have different objectives. In terms of Pathfinder, they walked concurrently in this process. So first, I'm going to talk about the Infodengue project. It's a monitoring and alert system using mathematical modeling and statistical models to generate early warnings for the transmission of dengue, chikungunya, and other arboviruses as well in all states and cities of Brazil. We have a website you can access using the QR code, where we have reports with the epidemiological situation, and we also provide maps and alert levels, uh, climate conditions for the transmission of arboviruses. And when we decided to align with Pathfinder, the structure and method, we saw a possibility to map and identify problems in the workflow of our project. A project that started from a structure that was very small with objectives that were mainly academic, and it grew in very much because some health secretariats of Brazil uh, asked us to map and identify um, several issues within this project. We also had to map stakeholders and content repositories, and also improve our dissemination and communication strategies, connecting with other institutions for research and exchange experiences. I'm going to summarize a little bit all the work we did, because I have the objective of presenting the Infodengue, but also the Infogrippy project and Pathfinder projects uh, that was headed by my colleague Danielle. He couldn't be here, unfortunately, so I'm sorry. I'm going to be very quick here. For Infodengue, we had some important challenges to tackle. It started organically and it grew very fast. Since 2021, we had a great volume of data to treat in terms of epidemiology and climate as well. These are the main data we use, so we needed to restructure our infrastructure and also streamline our algorithms to be able to handle so much data. We also had a data security issues because information was sent by email and we needed to better protect sensitive information because of the Brazilian data protection law. We had to prevent unauthorized access to data, although they are secondary and anonymous data. Besides those challenges, we also had a team overload challenge because it was a limited technical team that daily faced growing demands for analysis, system maintenance, user support, and development of new projects and functionalities. We also needed to engage several stakeholders because the project interests not only researchers but also health managers for decision making, academic institutions that are our partners, and also the civil society. So that requires differentiated communication strategies and also alignment of demands and expectations. The solutions for these challenges uh, had some points that were mapped using the methodology. Some we had find already, but for others, Pathfinder was essential because it showed the bottlenecks and directed and guided our actions. The first solution was restructuring our codes and servers to be able to handle all that volume of data. We migrated our architecture of our systems to a more efficient architecture. For instance, for climate data, we use data from airports. We started using satellite data. And all these changes and reinforcement of structures decrease the time necessary to process data and also responsiveness, also solving security problems. We used a cloud. We moved to an institutional cloud structure to ensure scalability and also security, not only for data transmission, but also capture. And besides, it also reduced operational costs substantially. Also solving overload issues. We hired a dedicated professional to coordinate and plan and articulate between teams, alleviating technical overload and improving our deadline management. So this was fundamental for our Pathfinder project. We also implemented the use of collaborative tools for asynchronous uh, we used a digital platform for documentation, communication, and process tracking, facilitating teamwork and transparency. As a result of that, we had important lessons learned. The importance of having clear protocols, detailed processes from data collection until dissemination to ensure continuity, facilitate onboarding of new members in the team, and also enabling auditing, direct and continuous communication using open channels between technical teams, managers, and the end users of our products. We also standardized our workflows, reducing variability and minimizing errors and allowing for the expansion of the process to other regions, both to increase and to reduce work scales. Also, the organization of the documents in a systematic way allows us to have centralized repositories that facilitated consultation sharing and institutional learning. So we could continue this mapping. So the Pathfinder brought essential, crucial learning to our InfoDengue project, especially for high volume projects like this one. Now I'm going to talk a little bit about Infogripe. It's an initiative to generate early warnings for respiratory syndromes, especially SARS, using data from the National System of Mandatory Notification, the CINAM. These data, in case of Infogripe, are presented by state and health regions. It says Infogripe, it's wrong here, but I'm talking about Infogripe. The main objective is connection with Pathfinder to map stakeholders, connect with other institutions, research institutions, and improve exchange of experiences, improving communication strategies. Since this Infogripe project, especially since the pandemic, it has great visibility, not only for health managers, but also for the press. It's reference. The challenges of this project was structured management of communication and media interactions, creating centralized processes, defining spokespeople, and screening workflows. We also needed to create an articulation of structured processes with stakeholders, creating situation rooms and direct channels for communication and specific strategies for each different audience. So, health managers, the civil society also use this data for public information. And growing visibility, especially since the pandemic, and the use of the results as a way, as a base for decision making by health managers. It involved a need to develop simpler visualizations, clearer categorizations, and also interactive dashboards, and also a review of graphical representations. So the solutions, how did we solve those problems? We integrated new professions to redistribute responsibilities, reduce workload, and optimize the bulletin production flow. Also standardized the production flows of bulletins with a weekly pipeline and defined stages involving analysis, writing, internal discussion, and dissemination. Also improve data visualization and products. More interactive, they became clearer, more intuitive visual objects to improve interpretation on the part of managers and the press, and also a systematic documentation of processes. It was fundamental for the mapping of Pathfinder methodology brought us. It allowed us to have a planning matrix and qualitative records for the processes, consolidating a structured monitoring system, allowing to identify bottlenecks and guide future improvements. We learned so many lessons. The first was early integration of institutional communication, engaging social communication since the initial stages to avoid noise and adjust language. Also, continuous feedback cycles with the stakeholders and technical teams to adjust methodologies. The importance of documenting every stage to improve replicability of the model, and also flexibility to respond to emerging scenarios, as happened in the pandemic, where we had a great increase of SARS, and routines had to be adapted to the new volume that the scenario brought. So the mapping consolidated essential learnings that can guide other data-driven epidemiological surveillance initiatives. So that's all I had for the moment. Thank you for your attention.
That's wonderful. Thank you, Sarah. And yeah, there's some emerging comparisons there to see from the presentation so far, from what people are saying. They've the challenges they've had with their projects and how the Pathfinders helped support some of that. So that's really interesting. And I think that thing about adaptability, the ability to be flexible, and the recognition that we might have to, we don't quite know why or where, but something might come along, and the ability to adapt based on that. So moving on, we're going to hear about strengthening community engagement in rural settings. This is Pathfinder in Colombia, and this is Juan Pablo Patache. So Juan Pablo is a research assistant at the Universidad del Valle, Colombia. He's a professional geographer and PhD student in environmental sciences, specializing in territory and environment. His research work focuses on spatial analysis, and he's currently a researcher as part of the Global Health Network, LAC, a member of the Pathfinder team, and he contributes to capacity building initiatives. So, Juan Pablo, over to you now.
Bom dia a todos. Vou falar do Pathfinder I'll talk about the Colombia Pathfinder, and I'll start with the scheme where I show the context of our host study. Sorry, the host study and its objectives of Pathfinder here. The study was developed in Paquetá, this region here in the municipality of San Jose in Corígeo. And the host study established three research plans. The first one was characterization of healthcare system in the territory. The second, characterization of the socio-ecological part. And the third focused on governance and social organization. And a cross-cutting area for all these plans was the focus with a gender approach. And we had four key outcomes. The first of them was monitoring, community water monitoring. The second, course in rural and community health. And the third, a forum. And fourth, a workshop on women around care. Relating to those outcomes, we had three objectives related to the Pathfinder studies. The first, to process map of the community engagement strategies in the host project. The second was the methods used by the host team. And the third, strategies of political incidents developed by the host study. So we have these key outcomes in Pathfinder: a mapping of the process and the strategy, the secondary repository, where we put some important data, a populational study that was developed in the host study, and third, focused on lessons learned and recommendations for conducting participatory action research in the region. Going on, the method was around three phases. The first, documentary review and analysis to characterize the community engagement strategies that could be used by the host team. There was also a workshop for women on care. We identified methodologies in phase 2 and tools developed by the host team. And besides, we adapted to we adapted the population studies to the FAIR study because it was rich of data, and also to promote reuse, and sharing of data with the scientific community. Phase 3 was studies with the host project team to map stakeholders and characterize strategies for advocacy and social appropriation of knowledge. In terms of results, I would like to start with a process map of community participation strategies. It was done along with the host team. Within this process map, you you can find it on our website online. We decided to structure in it around four categories. One, planning of the strategy in terms of participation. Two, development. Three, results. And four, lessons learned for the implementation of the strategies of community engagement. We also identified a cross-cutting theme across all strategies, which was trust building and articulating development, planning, and results of all community engagement strategies. And also the importance of providing care spaces to guarantee effective participation considering gender roles along the implementation of the strategies of community participation and engagement of the host project. We had a moment where we had low attendance of some participants with the reason, the inconvenient was that they couldn't come because they were taking care of the children. They had no one to leave the children with. So the host project quickly implemented the strategy. And one of them was the mini diplomado, where we gave space for women and men as well to be able to come to these spaces and leave their children under the care of professionals that were facilitated by the project so they could participate in our strategies. In terms of data collection methods and tools and research methods, we identified focus groups as spaces that consolidated collective trust and empowerment. Also, that's very important when we're working with social organizations in these places. These organizations are very they manage spoken language very well, and they work on the collective narrative. We use methods and tools to collect data on the part of the host team that were working very well. And the quantitative methods, as I mentioned, populational survey was had very good results by the accompanying leaders that were acting as co-researchers. Then our host study had a fundamental part here with this role of a co-researcher that was involving leaders in the development of our populational study. As tools, I would highlight the use in this territory of tools such as Kobo Toolbox, which is a rural context where it's hard to get signal or connection. And this tool allowed us to collect data in this geographical context of these municipalities. Now, about the third result, referring to political advocacy and stakeholder mapping, we had advocacy strategies with the host team developing a forum socializing project results with local institutions. This allowed us to reach a great audience of community agents in the territory. Also institutions participated, and a dialogue was created that was so interesting on the part of administration and local actors in the territory. Also, the development of a booklet presenting findings and results for social appropriation of knowledge within the communities, and a policy brief with recommendations based on collected evidence of decision makers. These strategies were created by the host project, and they were very welcomed by the organizations in the territory. We then mapped stakeholders through the focal group and also members of the host project, identifying new ties, alliances, and also collaborations between community actors, helping to promote intervention and execution of the project, the host project. So in the framework of these researches developed by the project, we were able to strengthen organizations, community organizations that develop ties with the projects and other organizations within it. In terms of conclusions, I have three big conclusions from the implementation of the Pathfinder. First, trust as a cross-cutting axis of community participation, something we can notice in this exercise of the project that we developed. And the success of community participation is not only on the use of isolated tools, but in the construction of continuous process of trust and horizontal participation of communities. Political advocacy strategies as a driver of generational renewal. It allowed for the participation of young and new leaders in these settings, especially at the community level, to be able to manage the community work in the region. And we can say that this was reached through these innovations that were brought and the challenges that were overcome by the host project with the process map that you can find online on our website. And the application of the Pathfinder methodology was a strategic instrument for reflection and leading to the strengthening of the research practice itself in research cultures in the territory. That's all. Thank you very much.
That's wonderful. Thank you, Juan Pablo. Yes, I think that aspect of trust is really important, isn't it? And the value of community engagement with the process of research, building that kind of that long-term trust, so that over time it's going to help support future studies and future collaborations with the community and other groups. So thank you so much for sharing that with us. The next presentation is going to be on the process mapping and identification of challenges in the Zika in pregnancy in Honduras study. And presenting is Katia Lopez. So Katia Lopez is a microbiologist and clinical chemist with an MSc in epidemiology with an emphasis in implementation research. She works as an epidemiologist at Unidad de Investigación y Gestión Académica, so if I've said that wrong, the UIGA Research Unit and Academic Management in Hospital Escuela, Honduras, where she leads the Global Health Network LAC Honduras activities. She's also a member of the Antonio Vidal Institute. So Katia, over to you.
Good morning. Thank you, Adam, for the introduction. Well, as Adam mentioned, in this session, I'm going to present our experience implementing the Pathfinder study in Honduras. We applied a host study in Zika in the pregnancy. So it's ZIP. Our study is called Pathfinder ZIP Track Study, Process Mapping and Identification of Challenges in the Zika in Pregnancy in Honduras study. To explain the context of the study in terms of pregnancy, this started in 2016. And first, regarding Zika, and over time, it was consolidated for other infections in pregnancy and evolving to what we today call ZIF2, involving other diseases, including the Chagas disease. That's very important in our context. So for the next few minutes, I'm going to focus on that, how we mapped processes and what we learned about what's the most important. To put this in a timeline, how the zip track was developed since May 2024 to November 2025. From May to June, you can see in the timeline, we defined the purpose and scope of the project. So was the conception part. Then we had design with a protocol and instruments based on the Pathfinder methodology with an analysis plan as well. It's important to mention also approvals. So institutional and ethical approval. Then we went to the recollection stage in February, March 2025, then data analysis, writing, drafting, and finally the submission to a journal that was done last month in November. We submitted the study to a journal, and after publication, we'll be sharing to all those who are interested. To talk a little bit and summarize our experience in the creation and conception of the project, we defined very clearly what we wanted to achieve with ZipTrack. First, the general purpose of the project and specific objective was defined. It was to systematically reconstruct the stages of the ZIF study and its transition to ZIF2, identifying operational components, barriers, facilitators, and solutions in a context of health emergencies and limited resources. Here too, we define the reach, the stages, for the population analysis period and the products, the outcomes expected. Then in the slide, you can see a summary of the design of this project, of its methodological aspect. In terms of methods, as I mentioned, we worked with the Pathfinder approach, study of with convergent mixed methods and descriptive. So first we did it parallelly and then complementary to reach a more thorough view of the whole study. In terms of protocol and instruments, we used Pathfinder Tracker, and it's important to mention that its structured version was used and always available for those who are interested in this session. It basically works as a matrix to document all stages of the study. And this information was collected using a questionnaire online organized for the implementation team of the project. This is important to mention. It was organized in stages. We had a semi-structured interview guide for key staff using data analysis and a data management plan to organize information and have a map of the process that was systematic. Finally, the study also relied on institutional and ethical approvals of the ethical committee in research and data and medical research of the Universidad Autónoma de Honduras, respecting the approvals for research with human beings. Regarding data collection and analysis, I'd like to share with you that for the focus, the quantitative focus, as I said, we used an online questionnaire and the team was invited to participate because the institute collected in stages. Every person participated, added data on several areas, levels of difficulties, products, and each of the parties involved answered the questions that the implementers. In qualitative terms, we had a structured interviews with key members, and we also wanted to include at least one participant of each stage of the whole study in this part. The interviews were recorded and transcribed literally, so they would be later analyzed with open code. Data from the questionnaires were organized in stages and analyzed. The qualitative material was systematized in categories and linked to Pathfinder Tracker, which allowed us to identify barriers, facilitators, and solutions for the whole study. Our results, very briefly, I'd say from the answers we received in the questionnaires, we organized a sequence of operational stages, background experience in Chagas, and dissemination of results. For each activity, know we rated difficulty level, low, medium, and high to identify process points that required greater effort from the institution. We also systematized quantitative information in stages, activities, resources, tools, actors, and outputs describing operational components that supported the implementation of ZIF and its transition to ZIF 2. Together with this map, you have access to it when the paper is published. I'm going to share it too. I just like to summarize what was done in this map, but also go beyond and show how the study was articulated to keep it working over time. Also, as part of the results in the qualitative component that helped us understand better the barriers behind the process. So from the analysis of interviews, we collected 3 domains, basically. One was structural, marked by changes in turnover in authorities and governance that caused friction and required realignment repeatedly. In technical and operational terms, the rapid startup with limited diagnostic capacity, constraints on sample preservation, complex follow-up logistics, and workload. We should remember this happened during the COVID pandemic, so these challenges were very important to be overcome. And also a contextual support area where the COVID-19 pandemic and reduction in services interrupted enrollment and in-person visits. So these 3 areas give us a common language to talk about problems that many teams face, but are very rarely documented at this level of detail to allow for a Pathfinder study. And to conclude, what was learned from ZipTrack and the research team? It allowed to document structuredly the conditions that sustained our health institutions, making barriers and steps, everything very visible, things that otherwise would be dispersed and just in the memory of the research team. So from this experience, we recommend and promote actively the integration of tools such as Pathfinder Tracker and for application in different studies, as we've seen over the session, mainly in countries of middle and low income, to strengthen research preparedness, study continuity, and practices aligned with equity, sustainability, and local relevance. Thank you very much for your attention.
That's great. Thank you so much, Katya. If we move on to our last presentation, then we'll have some time for a Q&A with everyone who's presented so far. So do please think about some questions that you'd like to ask specific individuals, and some of that's happening at the moment in the chat, but also more broadly to everybody. Coming on to our last speaker, so talking about navigating early implementation of a neurocystic sclerosis trial, preliminary insights from Pathfinder Peru, and Tania de la Cruz is going to be speaking on this. She's a physician researcher and project manager for the Global Health Network, LAC Peru, based at Universidad Peruana Cayetano Heredia, UPCH, and her work focuses on implementation science, neglected infectious diseases, and capacity building in global health. So Tania, I'll move to you.
Thank you, Adam. Good morning, good afternoon, everyone. I'm going to present the results and preliminary results of the Peru Pathfinder. It's ongoing. We have some advancements that we're going to present now. In this slide, you can see the full title of the project, which is process mapping of the recruitment to enrollment phases of a multi-center trial for the treatment of mild parenchymal cerebral cysticercosis. And we're going to map the early stages of this process: planning, development, overview, before patient follow-up. So the first part of the clinical trial for the treatment of neurocysticercosis. The context of the Pathfinder is very similar. Pathfinder, like others said, and we see that in our clinical trials, there are many challenges to implementation, planning, recruiting, but also retention of patients, specifically about clinical trials. We can find many barriers that are institutional or in terms of teams or our staff. It can all affect the execution of the clinical trial during the process. In this context, we've developed 3 objectives: to map the recruiting stages, identify barriers and facilitators in the processes, and propose, and I believe this part is important, propose recommendations and solutions, not only for the clinical trial, but also future studies that are similar or studies with different designs, but using the same recommendations and solutions. The design, it's a Pathfinder framework, prospective with mixed methods. We are doing it at the same time as the clinical trial that's currently ongoing, and the host is a multi-center clinical trial on mild parenchymal neurocystic sarcosis. This trial is going to happen at 2 public hospitals in Peru. Both are reference for this disease. They get patients from all over Peru coming to those 2 hospitals. And that's why we chose those 2 places to apply the Pathfinder. In this slide, you can see 2 graphs. I'd like to look at the left first. It's a general scheme, a logical scheme of the method of this Pathfinder study. We have the phases, our specific aims for each, the processes, the actors involved, and the outputs we expect to achieve for each phase. Let's first focus on the first part that's in gray. 3 great phases: preparation, process map creation, and process map validation. In green, we have what we've already done. In yellow, it's what we are doing, and in white is what we still have to do in the following months. So preparation phase, we have coordination with the teams of the clinical trial host, to start to present and prepare the work. And we started creating this map. We identified 3 phases. So we first did documents and review, then interviews, and later we're going to observe how the processes happen in real life implementation. So we are advancing in the 2 parts, and the last part I will just explain briefly. We haven't done it yet, but validation will be done through workshops with the study team. And then we expect to have a final map, final recommendations and lessons learned, and barriers and facilitators consolidated. On the right, you can see a timeline or how we are going to advance. You can see Pathfinder there, host study. Ironically, the host study had several difficulties in the part of planning, and the essay of the host is taking longer than usual. It's not so positive for it from the point of view of the Pathfinder. We obviously expect that not many difficulties will happen, but we are collecting more information than we thought for the planning phase of the clinical trial. We have started to do this. You can see interviews, and that's how we are working. These are not yet conclusions. We can see them as observations that the team has found institutional barriers that generates the greatest burden. You can see here that the barriers and facilitators I placed here, uh, institutional barriers are the most difficult. and talking about specific parts, training, support for the team. Many have mentioned time management, their limited communication skills that could be strengthened, and also that neurocystic psychosis is a disease that patients take long to understand, because what happens is that they come to the clinic of our study with many questions that haven't been asked by the neurologists. There's not much time and a lot to communicate. So many people say in the interviews that they feel communication sometimes is a challenge to them. Also, the fact that of having a continuous review of roles and responsibilities. Facilitators also mentioned facilitators that point to the internal capacity of the team to adapt to complex situations, such as the one they are experiencing now, planning stage that's a lot longer than we expected, with operational autonomy to solve problems, and say they trust the expertise and leadership of the team. And also they feel they're able to solve conflicts. It's interesting that they haven't identified in the part of institutional facilitators. Of course, it's still ongoing, but it's also interesting to talk about strategies to improve. And some are here on the right. Some interesting ones are, for instance, the fact of improving or strengthening communication skills. And also, something interesting was the visual task management. They said it could seem very useful to have the tasks in a place where they could see them, who is doing what, and that could facilitate decision making. This is interesting. So we are collecting these things. In process mapping, how we're doing. Uh, on the right, I show some of the process map demonstrations. We we have preliminary drafts of 5 macro processes of the host study. You can see them here. They're planning, recruitment, pre-screening, screening, enrollment. And here, Pathfinder ends. We're not going to enter the phase of follow-up, just the first part. So from what we've already done, a review of some documents and first drafts we have here. I'm not going to detail what's in there, but because the dates and this is going to enrich these steps. What we are doing, I don't know if you can see the little stars there in red, is to find and identify places and critical points, because a question we start asking ourselves is which processes should have been mapped in more detail, because in many processes are happening at the same time and we can't map everything. So at the moment we identify critical points, and this serves as a guide to keep advancing in mapping. This is what we have as advancements so far and what we wanted to present to you today. Thank you very much.
That's excellent. Thank you so much, Tanya, and all the speakers as well. And so we'll move on to a Q&A session. We've had some questions coming in for specific speakers, which have been answered directly in the Q&A. We might come back to some of those as well, just so that they're not kind of lost. Although we will, at the end of this session, as well as showing the recording and with the notes, we'll also be putting together the different questions which would come together. I don't know whether we're going to perhaps pinpoint all the speakers and ask them to put their cameras on. It'd be useful to do that. I can spotlight you all and just have some initial questions. Well, I certainly have some questions of mine, and maybe I'll start off with that. First of all, one of them actually, ironically, was around building in reflection on a process. And I'm aware with Q&A sessions, sometimes we leap straight in and say, what questions have you got? So we've got enough time in this session now for people to have a little think and, address questions in the Q&A. And also for the speakers to talk to each other and have questions as well. I'm also aware I'm the English speaker in the room, and I'd be very happy for people to be talking, communicating in Spanish and Portuguese, and for me just to help guide those discussions. But if speakers could all put their cameras on, and Lily, I don't know if we have them, everyone spotlit or pinpointed or whatever we use in the vernacular for Zoom. One question just before we come to some which have been asked is, I know right at the beginning somebody was asking about innovation and to what extent the Pathfinder can support this idea of innovation. Of course, innovation doesn't have to be a unique digital tool. It can be an innovative method or an approach which can be used in studies. But I have also seen a few points and questions which people have had around those collaborative tools. So as mentioned, a couple of different talks were talking about different collaborative tools which were used, and the need for visual task and workflow showing what people are doing. So, and I know some questions were asked and answered in the Q&A on that as well. So if I could just ask different presenters, and maybe I'll target people, just if you've got some examples of collaborative tools which have really worked for you, which you think it would be useful just to share with everybody here as well. And that could be everything from a project management tool or a particular means of communication, whatever it might be. I think that would be really interesting to hear what people have to say. Danny, I think I'll go to you first of all, see if you have any examples which you think would be useful to share, and if you think of any afterwards as well, we can share in the chat. So just there was a question earlier around what Cube was that somebody had mentioned. I know you'd helped and you contributed to that as well. So just any examples of collaborative tools which can help support a team, which upon reflection from the Pathfinder studies, people have thought that would be really useful for other people to know about. I think it'd be quite nice just to share some of those. So if you haven't got any examples, that's fine. I'll move on to someone else. Danny. So yeah, I'll go to you next.
First of all, I think the important thing to say to everyone that's listening, and we have some time, and we can talk about what the Pathfinder was, because for those who don't know, the first tool, I think, is reading the paper to understand the framework. Then, as you saw, there are different characteristics. We went from clinical trials to surveillance systems. So the framework can be adapted to different types of studies and processes. In each study, I think each of them found tools that adapted to the whole study and to the mapping process. So I would recommend that you go to the website to find detailed information on each Pathfinder and how they used the tools, because when we talk about Pathfinder, it's a binomial. In the Argentinian case, for instance, all tools we identified during the process were tools for qualitative analysis and quantitative analysis that our team already used before because we had experts in research. So it was nothing extremely new for the team itself, but it can be new when you go to the website and you find those tools. But I believe one thing that we cannot overlook is that besides the tool we used here, there is a space for the use of the Pathfinder framework. Because if you apply it to research studies, the ethical barrier for the implementation of Pathfinder that's still not a very well-known framework and still needs some validation, you can find a little more difficulty along the way to apply it, the theoretical framework, but it's an important gap because the Pathfinder framework can be very well suited to the improvement of processes. It has to do with the study. It can be applied so that in your workplace and your practice, your clinical practice, you can map and apply the same framework there. So I believe the best way to do it, besides talking about specific pathfinders, is you must consider that if you don't have a host study and if you have difficulties for ethical approval due to requirements, ethical and regulatory requirements, and the nature of the host, you must mention that the framework can be very interesting and useful to apply in projects for the improvement of processes that do not need to go through an ethical assessment. So I think this is the main thing, how to increase the use of the theoretical framework in itself.
That's great. Thanks. Tanya, I can see your hand raised and then Sarah. Oh, sorry. Sorry, do you want to address first?
In the case of the collaborative tools we used in the InfoDengue and InfoGripe projects, this is an interesting experience we can share because we have had experience with very many different tools, collaborative tools. We've used Trello, we've used WhatsApp groups, Telegram groups, and these tools, they were useful at the time, but they didn't have the capacity to retain specific servers for all projects like InfoDengue as a whole had. Not only InfoDengue, but collaborations it had. It's a big project that collaborates with other projects as well. So we were able to, after several trials and errors, have a messaging, a synchronous messaging tool that's very much criticized and used in digital games, but to us, it works well as a work tool. We use Discord as a tool because we can create specific servers for each sub item, and we work in those servers independently in each stage and parallel process. And the repositories of our work are scripts and codes that are open. They're all in GitHub. So to us, I like to share this experience because before we had difficulty to keep repositories for the storage of asynchronous questions because we're always working in the same time zone. So as an experience, this was important to us to communicate that So people maybe who have this difficulty with big projects can use this experience.
Wonderful. Thank you, Sarah. Tanya.
About that, I believe for us, Pathfinder in itself is like a tool. I see everything as a tool. I know it has a tracker, and that's a tool in itself. But to me, we considered an innovation. We feel it as an innovation, especially in this Pathfinder, because the team has teams that are multidisciplinary. We use qualitative and mixed methods. So the theme in mapping is used to doing this. They are very, say, it determines a little bit how they go through the process. They are focused on clinical trials that tend to be very rigid and more strict. And actually, when I listened to Daniela, we haven't had problems with ethical approval, but we felt sometimes that the team we are mapping has some doubts about whether what they're commenting is ethical because they don't know. When we have problems with ethical approval, you don't want to go into too many details because they feel the ethical part maybe is limiting. So we don't talk about that so much. We just focus on processes. We feel this collaboration work they're not very used to using was not felt as something negative, but as something new. And this novelty makes people feel sometimes a little dislocated. They need to work on it, and it has called their attention. And I think at the same time, we also notice that they're working on a moment of publication, and it's going to be interesting to see what we worked in those workshops. So thank you. That's what I had.
Thank you, Tanya. And Juan Pablo.
From my experience in Pathfinder Colombia, especially in the work with the host team, before anything else, I'd like to highlight that our Pathfinder was based on the host study participatory research. So it was already a big challenge to adapt the Pathfinder and the whole study to the tracker. So thinking about what Tanya said, all the Pathfinder methodology is very new and allows us to continuously think about each step or stage of our research. So in the same exercise, at least, we included that reformulating some categories because we didn't fit into that tracker perfectly. And that's the beauty of it, because I think the method is very nourishing, that it allows for adaptations of the tracker to show the experience of execution of a whole study within the methodological and qualitative, quantitative diversity and methods, which is a challenge to adapt a project. What was executed using mixed methods. So it would be interesting to have a Pathfinder on a research project with mixed methods. But that's the beauty of it, that we can little by little polish our tracker and make it a reference for the diversity of projects that we may execute using the Pathfinder methodology. I think that's the challenge. And I'm delighted the host team was very committed to this methodology when they understood that they could leave those inputs and lessons learned to future research, and especially Colombia in these contexts of conflict and post-conflict geographical context is very important for all research. So future research projects can identify that in the territory. So obviously it was something very new, and we used the Pathfinder methodology in the territory, and we could share that something that facilitated our work very much was the tool to allow us to create flow charts. It's very intuitive and allows for collaboration of several people at the same time in the team. This is important to highlight from the project experience in the Columbia Pathfinder project.
That's great. Thanks. Yes, adaptability of the method is really important. I think it really sort of links in with. I really was an advocate for that kind of the ability to recognise there is something. Here's an approach, but of course it has to be adapted regionally, and that's the as you say the beauty of this tool. Katia or Louise, I'm not sure if you want to contribute to this question. Yes, Louise.
In my case, from the first experience of receiving the tracker tool and noticing how it embeds into the host study, because we had the strength of the Pathfinder is that it adapts to every context. So we saw how it can be used in our context with qualitative elements, and that's what I would like to highlight, that it's very important and necessary to have a tool like that, an innovative tool for continuous innovation that's open to feedback and recommendations, and be able that Pathfinder now luckily is a product that's very close to us and to the users. So the recommendation we receive is that we can always improve and develop, and that makes us sure that we can uh, change it according to project needs. And this is the possibility of collecting information through the Pathfinder of the host study, and also to renew the Pathfinder is how it's done in the context of each research. So that's very important.
Thank you. Katia, I don't know if you want to add anything.
Yes, I also share what most said here, the points you have approached regarding our context. I'd like to say that as informed, when we use and implement and adapt a new methodology, it's always a challenge. But once it's understood and we recognize the usefulness, it's a lot simpler to adopt it, and not just adopt, but to us in Honduras, it's very important to share and promote in other areas the use of this methodology. Another aspect is that there have been challenges, and this is normal in these processes, especially when we're talking about innovation or some technology modes in terms of the spaces we have to share and look at the clinical data. So we always feel that we have a follow-up when we are in doubt with the team we are forming. It's so rich to be able to share those different studies we are developing here with our host studies. And so it's been a very, very rich experience and a challenge also, because it's a moment when uh, we've been working on this and we've been successful. So thank you.
Okay. Yeah, many thanks. And we had a question from Louisa from Brazil, which I think is this is generally sort of answered that about the use of the Pathfinder tool. Um, I had a question. One thing that came up quite a lot when people were talking was around sort of team overload. Seemed to have come up quite a lot, and of course we are to expect that. But I suppose two things coming out of that. First of all, the ability and the need for continuous reflection while undertaking a project. But also, just going back to the team overload aspect of it, is there a way, have you learned anything from the work you've done so far that can help sort of plan for or mitigate what might happen with team overload? And you start off with an idea of what your project will be. Events happen, things happen. The team, the scope of the project increases, whatever it might be. Is there anything that you think you can learn in terms of how to make sure that you plan for that in the future, for future research, which you could share with people? So that's an open question. If anyone has any insights into that they want to share. Yes, Uwe.
In our case, in terms of the ideas that we included in the Pathfinder project in our planning, we took it into consideration to be able to not only plan the project, and naturally it increases our workload, but on the other hand, although important to have participation of people and teams from Pathfinder that are close to the host project, we noticed that a good practice uh, is that the Pathfinder team is separate, that its work is only the Pathfinder project to avoid overload. And maybe several people on the team having to work on the project that's going on, but also Pathfinder. And a good thing I see is that Pathfinder can help mitigate these risks of work overload, because our view, considering the factors that the team as is working directly on it could identify and also mitigate. And the fact that the capacity to support mitigation, risk analysis before it happens, helps a lot to mitigate any potential consequences of a problem that we don't have a solution. So we need to put a lot of effort into solving it. So I think the
Mm,
Pathfinder can help in that as well.
that's great. Thank you. Yeah, Juan Pablo.
About our experience here of Pathfinder in Colombia, a recommendation I would make is that within the Pathfinder methodology, we can apply ongoing projects or projects that are already completed. So my experience, it's important to work better, especially when the projects are completed, because during the same execution, it was complicated to talk to the main researchers. It was difficult to talk to the technical team of the host project to present results and other things. So I think to decrease the overload, the idea would be that the main project is concluded already, it's completed. As mentioned, the implementation of the Pathfinder methodology must be made to promote this richness that it brings in other research projects, adding to this method, that since the beginning, we're going to have too much overload to map the challenges and barriers that show up in research and meet those challenges, bringing solutions from other experience to find a potential solution. So I think the experience from the same execution, we had some time constraints in our project for that reason, because there was an overload on the technical team of main researchers in the completion of it. So it would be good to ask when they have time, when they are ending, when they don't have limits and deadlines anymore, and then start the development.
Yeah, excellent. Well, thank you. Danny, I'll turn to you next, and then Sarah.
As I said in the beginning of my presentation about the host perspective, I am part of the host team of the Pathfinder. So when we requested uh, uh, that our study became a host to Pathfinder, we were clear that it would take time from the host team. And we would have to follow up on the development of Pathfinder, because within our regulatory excellence, the host is responsible for that. That was done knowing we had that responsibility and time and money and needs. And the host assumed that we needed that. We competed with other hosts and we were selected and we took responsibility. Of course, it took longer than expected in the beginning. So what we did, we accommodated the schedule, but we needed to use more time than we expected. That's not less important, because maybe about the study with requirements that are not minor, especially in clinical trials. A Pathfinder can be done without funding because it demands time and resources. And therefore, Pathfinder was funding the project. So it had its own budget for the study, but the host also needed to invest time and resources. Since the original study, here I repeat, I invite everyone who wants to submit to a call to become a host, that this mapping is done with responsibility and understanding what that means. In our case, our team was specialized in mixed methods, and we needed to get investment from other parties. So if the host is very complex study, it's experimental, it needs more resources or time, you may find more difficulty. And you must understand what it is and see what you need for the Pathfinder. Luckily, our team was very open to Pathfinder, but you cannot overlook that when you request and you submit an application to become a host, that you need to follow up with the Pathfinder and you need to invest time and resources for that.
Yeah, wonderful. Thank you, Danny. Sarah, I'll turn to you next.
On our part, as host projects, both InfoDengue and InfoGripe, it's two teams that already are overloaded. Very few people for multiple tasks. And in both cases for operationalization of the Pathfinder project, they were also part of the host project. And in that sense, I think to us, it was impossible to do it differently because our projects are continuous. They don't have a deadline to finish. Nowadays, Infodengue is under the scope of the contingency plan against arboviruses of the Ministry of Health. So this project will continue for some time more. So we try to adapt the roles as observers and participants to be able to make it fit into the project and having the Pathfinder scope there. And I'd like to clarify that that was a challenge, but also a strength because we counted on the team of GHN and our learning curve for tracker. It's not an easy one. Once you reach the understanding point, then you can reach your objectives and get from it all that's important for the host project. And that's crucial because the exchange of experiences, the organization that the mapping gives us is much more beneficial than the challenges that we have. So it's worthwhile to have the Pathfinder project. It was not easy to deal with the overload, of course, because we also had operational and academic competencies in the project, but it was also very gratifying. And we had a conference recently organized by the team of Infodengue. And we counted with a lot of help from the GHN team for the organization of this conference with very positive results in terms of dissemination, understanding of work, mapping, stages. So at the end of the day, everything was very, very good.
Wonderful, thank you. Katja, I'll turn to you next and then Tanya, and I'm just aware that the time has sped by and we've got a few minutes left. So Katja.
Thank you. I wouldn't like to go without commenting on our experience about this question, but in our case, the ZIP track study was not performed by the operational team. It was a mixed team with researchers that came specifically for Pathfinder and added to members of the host team. So to us, that was very important for several reasons. The first of them regarding overload, and it allowed us that the team of the host study could continue developing its roles specific to the host study. And its participation was focused on answering and providing information that was valuable to the Pathfinder study. And the work of organizing, codifying all this information, all that was for those who were completely dedicated to Pathfinder. So I believe this makes the process more realistic and it adds to the whole study when that's happening. Also, we also consider uh, the problem of bias. It's very good because people who are not involved in the day-to-day of the process could provide a fresh set of eyes to look at processes and ask questions that the host team wouldn't maybe ask because they seemed obvious. And somehow that balanced the view of the host team on what it could do, bringing the perspective of those who were outside. So that's our experience. Thank
That's
you.
great, thank you. Yes, I think in working practice, there's no better friend than a critical friend, is there? And Tanya, just turn to you for the last comment.
Yes, very quickly. Ours was also a mixed study, and it worked well for us because those who were not part of the trial could do field work. So we could keep a difference, not to repeat ideas. I would just say that Pathfinder is a flexible framework and it allows your Pathfinder team to be flexible as well. So we in the Pathfinder team also have to adapt, especially if it's perspective. Uh, so it must give you space for adaptations and tailoring as well. You maybe have to talk to the ethical committee depending on what they require, but it's not just the framework. The team has to adapt if you can adapt to the needs of the host without losing sight of the objectives, because we think that the Pathfinder is a tool at the service of the host that wants to cooperate with the host and not interfere, but support. And based on that, as that we worked. So I think
That's
we're out
wonderful.
of time.
Thank you.
So
Yeah, sorry, I
thank
just
you.
was aware because of the wonderful work of the translators. We've got to make sure we finish on time. And I'm sorry, that's my apologies for overrunning by a minute. I'd like to thank all the speakers who are with us today. We'll be sharing everything on the LAC platform and we'll be sharing the recordings with everybody as well. A special thanks to the translators for today and for Kirshan, Lily, and Larissa, and everyone at the Global Health Network who helped this wonderful webinar. So many, many thanks to everybody. Have a great day, morning, evening, wherever you might be, and we'll see you all for the next one. Thanks all.